Hi, we chose to do a project called Management of Maladaptive Behaviors in Children with ASD using antecedent exercise and a changing criterion design. The presenters are Kara, Jacqueline, Regina, and Sarah. Exercise therapy. It is well known that exercise has a significant correlation and effect on many chronic lifestyle diseases. Exercise therapy can lead to improved physical functioning in individuals. However, similar to taking prescribed medications, you will see effects of exercise if you follow the prescribed treatment regimen. There has been numerous population-based studies that suggest that there is an association between aerobic exercise and mental health. In Finland, a large group study was conducted that uncovered that individuals who exercised twice a week to 3 times a week were less likely to experience stress, anger, and depression compared to those that exercised less frequently. In a German National Health Interview and Examination Survey from 1997 to 1999, individuals with affective, anxiety, and substance dependence disorders reported higher quality of life when they engaged in higher levels of physical activity. Experimental studies have helped to confirm that aerobic exercise programs have consistent effects on mental health well-being. Exercise interventions have also been used to help make changes with the following behaviors: aggression, depression, sleep disturbance, hyperactivity, anxiety, stress, frustration, SIBs, and attention spans. Exercise as an antecedent intervention. There are many studies that use exercise as an antecedent intervention for individuals with developmental disabilities. Rosenthal, Malik, and Mitchell, 1997, looked at reducing self-stimulating behaviors in adolescents. They looked at the effect of aerobic exercise effects on self-stimulating behaviors and academic performance. They also measured the number of tasks performed during a community-based workshop. The results concluded that after the exercise condition, academic correct responding increased, self-stimulating behaviors decreased, and number of tasks performed accurately in the community-based workshop increased. In a study conducted by Bachman and Faka, 1983, they used an alternating treatment design to demonstrate the efficiency of aerobic exercise as an intervention for individuals engaging in multiple maladaptive behaviors such as aggression, SIBs, and yelling. The dependent variable was the percentage of interval of inappropriate behaviors. The results demonstrated that the mean reduction in levels of inappropriate behaviors between baseline and final treatment was 28%, which was consistent with other reduction rates in previous literature. Celebretti et al., 1997, conducted a study with a 5-year-old boy with autism using 2 levels of exercise, walking versus jogging. The boy jogged with the instructor for a full 6 minutes in the jogging condition and walked for the same duration in the walking condition. In the jogging condition, the boy's stereotype behaviors reduced significantly less compared to the walking group. How intense? Celebretti et al. 1997 demonstrated that jogging was a more effective intervention in reducing maladaptive behaviors. Elliott, Dobin, Rose, and Soper, 1994, measured several maladaptive behaviors. They compared general motor training and vigorous aerobic exercise as an antecedent interventions. Vigorous exercise was defined as elevating the heart rate to levels above 130 beats per minute after 20 minutes. Their study showed vigorous aerobic exercise significantly reduced undesired behaviors compared to the general motor training. Last, Kern et al. 1984 found that mild exercise had little influence on disruptive behaviors. Benefits of exercise as an antecedent intervention. Rosenthal, Malik, and Mitchell stated that aerobic exercise as an intervention will decrease negative behaviors while increasing desired behaviors. Majority of procedures used to reduce maladaptive behaviors are through manipulating consequences. With contingent conditions, teaching opportunities are contingent upon the individual exhibiting the target behaviors. But with antecedent conditions, it allows for continuous control, and as a result, immediate and consistent outcomes occur. Exercise antecedent interventions can be cost-effective and less intrusive compared to contingency-based interventions and less restrictive environments. Changing criterion design. Much of the previous literature for exercise antecedent intervention has not used a changing criterion design. Kasdan, 2011, stated that criterion designs are useful for behaviors that need gradual steps towards a terminal goal. Exercise is a great example of a behavior that needs to be increased gradually in order to help prevent individuals from experiencing extreme fatigue and/or injury. Fitterling et al. 1988 used a changing criterion design to look at the relationship between the amount of aerobic exercise and frequency of headaches in adults. His exercise program used Cooper 1977 points as the criterion at each level. Cooper points operationally defined the intensity of aerobic exercise for the study. The study's ultimate goal was 24 Cooper points during a week, which is the optimal criteria for an adult female in the study. Each individual's criteria for Cooper points earned at each step varied. Overall, the group averaged 23.9 Cooper points each week at the end of their study. Purpose. The purpose of this study was to use a changing criterion design in order to measure the amount of aerobic exercise as an antecedent intervention for the frequency of maladaptive behaviors across 5 children with autism. The independent variable is vigorous aerobic exercise, which is measured using Cooper points. The dependent variable is the frequency of individuals' maladaptive behaviors. Methods. 5 males and 2 females were used for this current study. Each was enrolled at Center for Developmental Disabilities in the Midwest. Children were recruited from the center and selected based on staff's reports of frequent maladaptive behaviors. All the children currently are receiving ABA services at the center for an average of 6 hours a day, 5 days a week, and all subjects have a behavior intervention plan that staff follow in order to address any maladaptive behaviors. All participants are capable of making vocalizations as a means to communicate. Ben was a 6-year-old male diagnosed with autism spectrum disorder. The Childhood Autism Rating Scale score for Ben was 33.5. Ben's maladaptive behavior included aggression, such as hitting, biting, and scratching, and SIBs, such as hitting head-on with open fists and throwing his body against walls and objects. The FAST was conducted and determined that Ben's maladaptive behaviors were maintained by attention and escape. Ben is currently taking Risperdal in order to subdue his aggressive behaviors. James is a 7-year-old male diagnosed with autism spectrum disorder and ADHD. The Childhood Autism Rating Scale score for James was 34.2. James engages in maladaptive behaviors such as yelling at others, shoving others, banging his head into others, banging his head against objects and surfaces, and spitting. The FAST was conducted and determined that James' maladaptive behaviors are maintained by attention and escape. James is currently taking Ritalin for his ADHD symptoms. Doug is a 5-year-old male diagnosed with PDD-NOS. The Childhood Autism Rating Scale score for Doug was 26. Doug engages in maladaptive behaviors such as yelling, screaming, elopement from workspace, throwing items at others, and property destruction. The fast was conducted and determined that Doug's maladaptive behaviors are maintained by escape. Patty is a 6-year-old female diagnosed with ASD. Her childhood autism rating scale score was 30. Patty engages in maladaptive behaviors such as pinching her extremities, crying, hair pulling on herself, and biting others. A fast determined that her maladaptive behaviors were maintained by attention and automatic reinforcement, paying attention. Lisa is a 6-year-old female diagnosed with ASD and ADHD. Her childhood autism rating scale was a 35.6. Lisa engages in maladaptive behavior such as hitting others, pulling other people's hair, scratching others, yelling, spitting at others, playing with saliva from mouth, biting others, and biting her extremities. A fast determined that her maladaptive behaviors were maintained by attention. Lisa is currently taking Ritalin for her ADHD symptoms. Experimenters and setting. 7 staff members from the center worked with the children. They worked with them during the exercise intervention and throughout the day on the child's other programs at the center. The experimenters were responsible for modeling appropriate aerobic behaviors during the intervention and responsible for recording the frequency of maladaptive behaviors that occurred. The exercise antecedent intervention took place with all 5 children in the gym at the center. The intervention was conducted first thing in the morning after the child arrived at the center. This was approximately around 9 a.m. The staff members completed the aerobic exercises with the child in order to provide correct instructions and modeling for the child. Staff also used contingency management such as verbal praise and encouragement of social reinforcers such as high fives, tickles, and spins. Frequency data on maladaptive behaviors was recorded until the child left the center for the day. Modes of aerobic exercise. There are a number of studies that utilize many different modes of aerobic exercises. In this particular study, the child had to complete more vigorous aerobic exercises in order to meet the criterion in their Cooper 1977 points. These activities included rollerblading, jogging, climbing stairs, relay running races, and walking on a treadmill with a high incline. The subjects had a choice of which activity they wanted to complete for the day. Breakdown of Cooper 1977 points. Fitterling et al. 1988's ultimate criterion for his female adults was 8 Cooper points a session and a weekly minimum of 24 Cooper points. In order to give you an idea of Cooper points in comparison to amount of exercise exerted, know that 8 Cooper points is equivalent to running 1.5 miles in about a 12-minute span. We use the same measure as Fitterling et al. 1988 when moving to the next level. The subject can move on to the next level when 3 consecutive data points are no more than 20% from the current criterion. We adjusted the goal somewhat in order to accommodate working with children. Ultimately, in our study, we made the final target goal for the children to be 6 Cooper points a session. The results indicated in these graphs demonstrate a positive correlation between vigorous exercise and the decrease in maladaptive behavior. In each criterion phase, the participants increased their exercise to the appropriate Cooper points to reach criteria. During each phase, the amount of maladaptive behaviors displayed decreased. 3 participants, Ben, James, and Patty, were able to increase their Cooper points and decrease behavior within the 18-session time frame. Doug and Lisa took a little longer to meet criteria. Both participants gradually raised their Cooper points but didn't perform consistently as quickly as the other participants to raise the criteria. After 1 month, each participant was given the opportunity to participate in a free gym period and their behavior was then tracked. In all cases, the Cooper points remained high, 5 or 6, and the maladaptive behavior remained low, 0 to 1 occurrence. The same procedure was repeated at 3 months, revealing similar results. Baseline and maintenance probes. Baseline allowed the children to play in the gym for an extended period of time with exercise equipment accessible. The experimenters recorded the amount of physical activity the participant engaged in. Maintenance probes were conducted after ultimate criteria was met for each participant. These maintenance probes were 1 month and 3-month follow-ups. The maintenance probes consisted of allowing the child to engage in aerobic activity with minimal assistance from the staff member. The number of Cooper points was then calculated. Inter-observer agreement. Investigators were able to calculate 100% of on-site exercise sessions. Percentage of inter-observer agreement was calculated by dividing the smaller number of Cooper points recorded by the larger number for each of the observations and multiplying by 100. There was 100% agreement for all sessions. Investigators were about to calculate 75% of ABA sessions at the center. Reliability was calculated for the occurrence and non-occurrence of maladaptive behaviors by dividing the number of agreements by the number of agreements and disagreements and multiplying by 100. An agreement on occurrence was scored when both the staff and the investigator reported a maladaptive behavior occurred. Average percentage of agreement for all subjects on occurrence of maladaptive behavior was 84%, range 38 to 100%, and the average percentage of agreement on non-occurrence was 92%, range 83 to 100%. Discussion. The current study suggests that high-frequency engagement in aerobic exercise is an antecedent intervention effectively decreases the occurrence of maladaptive behavior to near zero levels of responding across all participants. Exercise remained high and problem behavior remained low at the 1 and 3-month follow-up. This indicates a wide range of benefits for the participants within our study. The current study contributes to the limited research that has been conducted to assess the effectiveness of exercise as an antecedent intervention. Also, it could potentially be used as alternative to pharmacological treatment of maladaptive behavior. Overall, the antecedent intervention package used within our experiment is the potential to be a cost-effective alternative to other contingency-based interventions. Limitations and future research. Limitations. First, medications were not removed during the course of the experiment for participants. Second, a threat to the current study's external validity is that the experimental conditions were ran in a clinical setting. The extent to which the effects are generalizable across settings were not assessed. It is recommended for future researchers to include examining this within future studies. There are several additional features for future research to analyze further. In the current study, exercise was targeted at the start of the day, consistently throughout the course of the experiment. Future research should analyze whether or not conducting the antecedent treatment packages at different times throughout the day influences the effectiveness on the reduction of problem behavior displayed by the participants. Future research should assess the effectiveness of certain specific forms of exercise compared to one another to analyze if one particular exercise has the most influence on reducing maladaptive behavior in persons receiving the antecedent intervention. This slide shows our references that we used for our project. Thank you.